Welcome. Welcome to this FIP event on sustainable and equitable access to vaccines, establishing priorities and settings, policies in the Western Pacific region. My name is John Jackson and I'm President of the Western Pacific Pharmaceutical Forum. My co-moderator this evening is Dr. Parisa Aslani, a Vice President of FIP. Before I introduce the topic, I'd like to present a few announcements. As you have heard, this webinar is being recorded and live streamed via YouTube. You will be able to access the recording via the FIP website. You may ask questions using the box provided. The preference is to put it in the Q&A box, and we will attempt to have those questions answered during the webinar. You're always welcome to provide feedback to FIP on its webinars, and I would promote that you consider, if not already, becoming a member of FIP. Moving to the next slide. There are a number of factors relevant to vaccination that have come together recently, and I want to address just 4 of them in introducing our topic tonight. This year, the WHO established an Immunisation Agenda 2030, a framework for global participation in improving vaccination access. Secondly, there is growing recognition that vaccination is much more than about childhood vaccination. Concepts such as life course vaccination and vaccination for all ages are now influencing our understanding of vaccination. Thirdly, pharmacists have grown to appreciate that we have an important role to play in vaccination, including assuring supply, promoting where possible vaccination, and potentially administering vaccines. And fourth, the COVID-19 pandemic has led some governments to recognise and turn to pharmacists to be part of the vaccination workforce needed to provide urgent and population-wide vaccination. So, how has FIP responded in this emerging environment? FIP has worked with the support of Pfizer during 2020 to develop Transforming Vaccination Globally and regionally in order to address the essential role that pharmacists play in saving the lives of millions of people through the provision of vaccines. Next slide. Secondly, this year in 2021, FIP is following this program up with a focus on equity and sustainability of vaccination. And this event is one of the series being provided by FIP, both globally and on a regional basis. Next slide, please. So, the focus here tonight, which is the 5th of the 6 regional episodes that are being presented, is to look at the drivers for transforming vaccination in the Western Pacific region. This involves identifying priorities, especially with respect to equity and access to vaccines. And we also want to understand barriers and challenges in relation to policy. So it's my pleasure to welcome here FIP member organisations, stakeholders, and our partner organisations in the Western Pacific region to this event. And I'd like at this stage to hand over to my co-moderator, Parisa, to introduce our speakers. Parisa.
Thank you very much, John. Today we have 4 speakers from across the Western Pacific region: Stephanie Tay, Chris Campbell, next slide please, Leonila Ocampo, and Amrahi Wang. Each speaker will have approximately 10 minutes to present, and then after the 4 speakers, we will have a panel discussion where you're able to pose your questions. Please write your questions as we go along in the Q&A part, not in the chat section, but in the Q&A part, and we'll endeavour to answer those at the end. So our first speaker is Dr. Stephanie Tay. Stephanie obtained her doctorate in philosophy and bachelor's degree in science in pharmacy from the National University of Singapore. She has served in various roles in the Ministry of Health in Singapore and is currently in the Chief Pharmacist's Office. At the Chief Pharmacist's Office, she has gone back to her pharmacy roots and for the last 5 years has been working on pharmacy-related initiatives, including COVID-19 related issues. Please join me in welcoming Stephanie to present. Thank you.
Thank you very much, Carissa. So hi, everyone. A very good morning, good afternoon, good evening, depending on which part of the world that you are in. So I'm very happy today for this opportunity to share about Singapore and the vaccination programs that are available in Singapore. So I'll just start with the mission statements of the Ministry of Health, and that mainly looks at promotion of good health, reduction of illness, ensuring access to good and affordable healthcare, as well as the pursuit of medical excellence. And I bring this up because it ties me nicely to the impetus behind vaccination. Next slide, please. So the impetus behind vaccination, I think we are all very familiar with this, and it's mainly to protect ourselves as well as our loved ones from common vaccine preventable diseases that may pose a healthcare burden to our respective countries. So how does MOH do this? So MOH works closely with an expert committee on immunization, and they will review current vaccination policies as well as vaccines that are currently on national immunization schedules. So the things that they look at include the local disease burden in the country, the safety, efficacy, as well as cost effectiveness of the vaccines. And thereafter, the decision will be made whether to recommend the vaccine for uptake by the local population. Next slide, please. So in Singapore, there are currently 3 main vaccination programs, and I'll be going through each of them briefly. But I'll spend a little bit more time on the COVID-19 vaccination program. Next slide, please. So first and foremost, the National Childhood Immunization Schedule. So this is for children below the age of 18 in Singapore. So as you can see, there are a range of vaccines that are recommended for children to take. And for each of the vaccines, there's actually a recommended dose as well as age at which the vaccine has to be taken. So legally, there are only 2 compulsory vaccines for children, and that is the diphtheria as well as the measles vaccine. However, for children to enter primary school in Singapore, they are supposed to actually show proof of vaccination for the other vaccines as well. So effectively, this makes vaccinations about compulsory and taken up very highly by the children in Singapore when they're attending school in Singapore. Next slide, please. So moving on to adults. So for those adults that are age 18 and above, similarly, there are a range of vaccines that are recommended for them to take, and the dosage as well as the age that they are to be taken, there are also recommendations on that. For those who have specific medical conditions or immunocompromised states, they are also highly recommended to take certain vaccines. So this has been pushed out actually quite recently, and it's being uptake is a little bit slow, which I will discuss later on. So next slide, please. So how are these vaccines made accessible and affordable to people in Singapore? Well, first and foremost, the accessibility is made throughout Singapore through public healthcare institutions, which includes 20 polyclinics, 9 acute hospitals, as well as various community hospitals. So the public can actually go there to have their vaccine taken. If not, the private sector is actually on board as well if they participate in what is known as the Community Health Assist Scheme. So under this scheme, there are a total about 500 GPs that are partaking in the scheme. So likewise, the public can go to these GPs as well to have their vaccines. So with regards to affordability, there are two-prong method here, subsidies as well as out-of-pocket funding. So for subsidies, children in general will get the vaccine free. So when they go to any one of those institutions or the GP, it will be free of charge. As for adults, there will be a varying level of subsidy applied depending on their age or income level. So in general, the higher subsidies are afforded to those who are more senior in the population, that's known as the pioneer generation, which affords them a subsidy of up to 75%. So for the remaining portion of the vaccine that has to be paid out of pocket, people can actually tap on what is known as MediSave, which is actually a compulsory social security savings plan. So this actually involves part of their income going into this social savings plan, and MediSave is actually the part ring-fenced for medical related expenses. And so this ranges from 8 to 10.5% of one's income, depending on your age. And so from this, people can actually use it to pay for the out-of-pocket expenses of their own vaccination, as well as their immediate family. For those who perhaps are not working or unable to afford the out-of-pocket expenses after vaccination subsidies, there is an additional bucket that they can tap on known as MediFund. Next slide, please. So in spite of all these measures, like I mentioned, the National Adult Immunization Schedule and then the subsidies were actually introduced very strongly in recent years. The last National Population Health Survey actually found that the take-up rate of vaccination by adults is still quite low. So for general adults, the rate is about 17%. For older adults between the age of 65 to 79, this goes up only slightly to about 24%. So there has been a small study done on a very small sample size. And this survey on attitudes, as you can see, I don't think I need to touch too much into this because I think it applies not only to the older population, but to the younger population and also across countries everywhere. But I'm glad to note that FIP has actually published a handbook on vaccine hesitancy, and I think that will be a very useful resource in combating vaccine hesitancy. Next slide, please. So I've done with the childhood and the adult immunization programs. So now I will just touch on the COVID-19 vaccination. I think this is something that all the countries are undertaking vigorously at this point of time. So I think we're all familiar that COVID officially started in January 2020 last year. So in Singapore, what was being done was the expert panel on therapeutics and vaccines was formed in April. And what this panel consisted of was 18 prominent scientists and clinicians in Singapore, including as well public sector agencies to help to bring the vaccines in. So all of them studied all the promising candidates for safety and efficacy. And so Singapore's equivalent of the FDA, our Health Sciences Authority, actually put out this pandemic special access route. So meaning that they did not wait for all the trials to complete before they started an evaluation of these vaccine candidates, but they took in clinical trial data as it was being churned out so that they could actually accelerate the review process. So with the PSAR, as we call it for short, there are currently 3 COVID vaccinations on the National Vaccination Program, and that is the Moderna, the Pfizer-BioNTech, as well as Sinovac, which was just added over the weekend. So after all this work, as you can see, the picture there shows our national carrier, the Singapore Airlines, very proudly bringing in the first batch of Pfizer-BioNTech vaccine on 21st December 2020. Next slide, please. So what happened next after the vaccines came into Singapore? Well, first, because there was limited amounts of vaccine in the beginning, so what happened was that there was a prioritization drive. So healthcare workers, frontline workers, as well as seniors in Singapore were prioritized for the vaccine, and they were highly encouraged to go for it before the rest of the population started to come on board. So vaccination is offered free to everyone. So to enhance accessibility to COVID-19 vaccination, besides the public healthcare institutions, as well as selected GP clinics, there was also a tender put out for vaccination centers. So private sector actually tendered and bidded for these vaccination centers, and there are quite a number of them all over the island. doing mass vaccination close to people's homes to encourage people to just pop over and get their vaccination. So for those who are not so mobile, we actually have the home vaccination teams for those bed-bound patients. So actually the team will go to their homes and get them vaccinated. For those maybe not bed-bound but not so mobile, we actually have teams going around Singapore to near their homes to actually get them vaccinated conveniently. So besides that, there are numerous campaigns and advertisements encouraging the population to actually get vaccinated. And as time passed with more vaccines in our country, there were no appointments needed for seniors, so they could just walk in. This also encouraged them to take up the vaccines. And recently, there was a boost in vaccination numbers as well because of the implementation of vaccine differentiated safety management measures. So things like, for example, the unvaccinated are not allowed to go into shopping malls, are not allowed to dine out. And this has actually prompted those who were not vaccinated previously to go for their vaccination now. So Singapore has actually reached quite a high percentage of vaccination overall. And just last month, we actually started the booster vaccination drive for those who have taken their two doses to take their third dose. Next slide, please. And so this is just a quick look at the numbers. So this is a hot off the press, 25th October. These are the latest numbers of vaccines administered, 4.67 million, which is works out to about 94% of eligible persons who can take the vaccine have been vaccinated. And a month in, our booster shot rate is about 724,000, and a vast majority of people have been vaccinated. So with that, thank you very much for your attention.
Thank you very much, Stephanie. We'll have some questions for you towards the panel, and these are fantastic numbers from Singapore in terms of vaccination rates. Thank you. Next slide, please. So our next speaker comes from Australia. Chris is a General Manager, Policy and Program Delivery and Queensland State Manager at the Pharmaceutical Society of Australia. A career-long advocate of excellence in pharmacist care and his critical role in improving the health of Australians, Chris is currently leading Pharmacist 2023, which is the Pharmaceutical Society's vision in raising the profile and reach of the profession with a focus on medication safety. Having trained as a pharmacist in hospital pharmacy and then leading community pharmacy group, Chris has progressed to hold senior leadership roles in professional services and professional development. Today, Chris continues his frontline work as a community pharmacy owner and also as an adjunct senior lecturer at the University of Queensland School of Pharmacy and a research fellow at the Queensland University of Technology. Please join me in welcoming Chris as our next speaker. Over to you, Chris.
Thank you so much, Parisa, and thank you so much for FIP for hosting this event, and congratulations on the work that you have done in this area, particularly advancing the scope of practice for pharmacists in the immunisation area. Also, thank you to Pfizer. You are pulling us out of the pandemic amongst other providers of the COVID immunisation. If I could go to the next slide, that'll be great. I do want to thank Stephanie. It was wonderful to have your background really similar in terms of what is funded within Australia. Give you a little bit of background. We are an island nation of 25 million people. We have 6 states and 2 territories, and that's important when we look at the immunisation access. Next slide, please. Across our states and territories, these are the areas that help to run our immunisation programs, and they also legislate on what pharmacists can do and our scope of practice. The federal government does fund our immunisation programs, and like what's going to look like most of the countries, really similar immunisation programs that are funded. And we know as soon as they are funded, we start to reach much higher rates of those. The rest of this presentation is actually going to focus on the role of pharmacists and the role that we are playing in immunisation, and finish off on the role we're playing in the COVID-19 vaccination rollout, as well as some advocacy asks. So hopefully we can all work together as a region to advance the practice of pharmacists and improve immunisation access and equity across our countries. Next slide, please. So this is the list of immunisations that pharmacists can administer and are administering across the country. You can see that there are some states, and my home state in Queensland has the largest number of immunisations that can be provided by pharmacists. Next slide, please. So if we look to the history, so before 2014, immunisations were provided in pharmacy, but they were mainly nurses that were administering those. In 2014, the Pharmaceutical Society, as well as a few other pharmacy bodies in Australia, were invited to take part in a pilot to see whether pharmacists could provide immunisation. So next slide, please. That started with influenza. And the reason they brought that on was our Chief Health Officer went through a pandemic in 2009, the H1N1 influenza pandemic, and they realised it is not useful to stand up mass vaccination clinics. You're getting people to gather together and increase their likelihood of contracting the disease. Why don't we utilise pharmacies? We have 5,900 of those scattered across the country. What a great way to utilise this skill, and that has been happening across multiple other countries for decades. And so what we did is we started this pilot and demonstrated that over 35,000 immunisations provided by pharmacists were safe and effective, and a 99.5 satisfaction rate. Next slide. During 2015, there were two outbreaks. One was whooping cough, the other one was measles, mumps, rubella, and these two were added to the pharmacist schedule in Queensland. Next slide. As you can see, this started to grow. So what happens in one jurisdiction, they tested out, and in this scenario, Queensland was the test bed and demonstrated it was safe and effective by pharmacists, and you can see other jurisdictions are starting to administer the vaccination. Next slide, please. See that start to grow. Next slide. And next slide. This is just demonstrating what happens when a pandemic hits. So you can see the large growth. As Stephanie mentioned, when COVID-19 hit at the start of 2020, there was a realisation that we needed to get our skates on. And then when the vaccination arrives in the country, we need all hands on deck to support. You can also see a growth in the number of immunisations that are provided by pharmacists to help to support the workforce and improve access and equity of access. But you can see only Queensland at the moment, at the start of the pandemic, was able to administer the COVID-19 vaccination by pharmacists. Next slide, please. Thankfully, by July this year, all states and territories allowed that to happen. And from the start of the COVID-19 rollout, pharmacists have been involved not only in the logistics, but in administrating immunisations in community pharmacy, in general practice, in our hospitals, in our COVID hubs, and also in areas like our Aboriginal community-controlled health centres and in aged care. Next slide, please. Next slide. And so this gives you a little bit of an update of what happened in Australia. We only have 3 COVID-19 immunisations available. Pfizer arrived in March. It's approved from 12 years and up. AstraZeneca, same time in March, and community pharmacy came on board in June 2021. Mainly recommended for over 60s for reasons around the TTS adverse effect. And just in September, Moderna arrived on our shores, and we've been administering that most exclusively through community pharmacy, but announcement today that will be available in general practice. Next slide, please. This is our coverage so far. So we're not quite there in terms of full coverage, but depending on the states, you could be lucky to live in Victoria, for example, where John, one of our hosts, is from, at 90% first dose. My state, Queensland, we have a little bit of catching up to do. If you go to the next slide, you'll get to see what's happening in community pharmacy. And one more click, it'll highlight the spot that I want you to look at. So as of today, we're actually 1.55 million COVID-19 doses, which is an incredible contribution by pharmacists, particularly considering we were very late coming on in the program. Next slide, please. We do have the third dose booster announced just last week for immunocompromised patients, and that is starting to occur. That's the mRNA vaccination. When I put these slides together, our booster dose advice was imminent, and just yesterday announced after 6 months from your first dose, that is starting to be administered. Again, that's Pfizer from 18. And just today we had announced the co-administration approved of influenza vaccination and the booster dose of COVID-19. So welcome news, particularly the role that pharmacists are going to play both in the influenza vaccination rollout and the COVID-19 rollout. Next slide, please. And next slide, I'm just going to cover off some of the strengths and weaknesses of our program, particularly with the focus on what pharmacists deliver. We do have coverage across the country of pharmacists administering vaccination, and that's pretty much in all practice settings. So we have pharmacists in hospital, Aboriginal community-controlled health centres, in the community pharmacy, in aged care, in disability care, be able to provide this. We had accepted as part of the immunisation workforce. We weren't at the start, but is now an accepted part of the workforce, and almost half of the profession are immunisation trained. It's built into our undergraduate degree, so pharmacists are leaving university with the skills to immunise. And thankfully, we have mandatory reporting to our National Digital Immunisation Register. That is not just for COVID-19, but that's for all vaccines we provide. It's really showing the value of pharmacist immunisation. We do have a pharmacovigilance system. Thankfully, that is in around 100 pharmacies monitoring for adverse effects from vaccination. And thankfully, pharmacists are funded to provide some vaccinations. Next slide. Some of our weaknesses, though. We can only provide immunisations from 10 years of age. So when COVID-19 moves to 5 years, we will need to do some work on helping to change legislation. Not all vaccines are able to be provided by pharmacists, there's only a select few. Not all locations, particularly when you exclude COVID-19. Most vaccinations are user paid and privately funded. There are no administration fees for that, again, all privately paid. And sadly, pharmacists are not paid the same as other providers to administer vaccination. There is lack of uniform access across the country. So some states that is funded through pharmacists to get national immunisation program immunisation, but it's not in all. And we do have students and interns able to immunise in some of our states and territories, but again, not in all. So some work for the policy team, and that's what hopefully will help to do in my role at the Pharmaceutical Society of Australia to advocate for this. And the very last page is what we would do if we had some policy change. We'd have pharmacists administering all vaccines to all approved ages in all locations and have that funding. Parissa, back over to you for the rest of the presentations. Looking forward to participating in the discussion.
Great. Thank you very much, Chris. That's a great snapshot of what's happening currently in Australia. So we now move on to our next speaker, Leonila, who many of you would be familiar with, as she's been a former president of the Philippines Pharmacists Association. Leonie has had many different roles and worked in many different areas, including academia, practice, and research. In the Philippine Pharmacists Association, she held different positions until she became its president for a duration of 4 years, where she effected a number of changes, most notable of which was the passage of the 2016 Philippine Pharmacy Law, repealing the country's 47-year-old law. She has received various awards, including the 3 Lifetime Achievement Awards given by different bodies. Currently, she's a member of the Executive Board of the Western Pacific Pharmaceutical Region and the EXCO of the FIP CPS, and president of the Asia Pacific Institute for Medication Management. Another busy lady. Please join me in welcoming Leonie to give us our next presentation about what is happening in the Philippines.
Thank you. Thank you very
Leonie.
much, Parissa. Thank you so much. Good day to everyone. I would like at this point to say thank you to FIP for the opportunity given to the Philippines to present and share what we are doing here And let me focus my discussion on how the pharmacists got involved in vaccination activities in the country and what pharmacists can do to address vaccine hesitancy and improve access to vaccination. So, next slide, please. Okay, let me just start with what we have ended with a presentation I made also last year. I said, immunization in the Philippines started as an advocacy. We were not allowed to immunize in the past until it became a program of the Philippine Pharmacists Association. So this was initiated by the National Organization of Pharmacists in the country. And now it is a certification program for pharmacists as we envisioned our pharmacists to become certified immunizing pharmacists to service the Filipino community. Next slide, please. And how we did this, we were developing and making this happen anchored on 5 pillars. So the pharmacy-based immunization program in the Philippines was thought of first by looking at what legal framework can we have and what management guidelines could be implemented. And then we need to train our pharmacists, as this is a new initiative that would be embarked on, and then promote information or market the activity and disseminate the information in as much as the public is not aware that there would be such a thing as pharmacy-based immunization services. And then we said we need to assist our pharmacists in setting up the services and monitor how this would be in order to really bring this to the success that we would like to see. And in the process, build up or gather data that we may be able to use for some research work that would be done in the future and evaluation purposes. Next slide, please. Next slide. And this is the journey that we went through. Previous slide. The journey that we went through embarking on immunization. So as I've mentioned, we started it as advocacy until it becomes a program now. This was well discussed in my last year's presentation. So this was in fact immunization done by pharmacists is facilitated by the pandemic that we were experiencing, in as much as there was a good demand from the Department of Health to bring in the pharmacists to the vaccination team that would be deployed, that would help the healthcare professionals doing vaccination, especially of the COVID-19. Next slide. Oh, and training the pharmacists, there were 2 tracks of training that we utilized because we need to prepare the pharmacists for the work. And we have had a full certification training program, which was developed by a team commissioned by the Philippine Pharmacists Association. And pharmacists who went through to these programs to be certified by the Professional Regulatory Board of Pharmacy, Professional Regulation Commission. And early this year, another law was passed that actually facilitated to the development and of another training track, which we call the COVID-19 vaccinator training. So this is focused only on the training on how the pharmacist could be prepared to vaccinate or to immunize or to administer COVID-19 vaccines. Next slide. And the certification also happened in 2 ways because of the 2 tracks of training. So full certification, making the pharmacist, the certified immunizing pharmacist was there. And then another certificate was issued by PPHA and the Department of Health for those who completed the COVID-19 vaccinator training program. This was done, the second track of training was done to facilitate deployment of pharmacists as vaccinators to different vaccination sites in the country, given that we really was in urgent need of the workforce that would do the vaccination activities. Next slide. Next. And pharmacists, also were accredited to be vaccination sites. And in the process, there was a need to review how the readiness of the workforce is, how the facility is, if there is a space that would be dedicated for that purpose, and whether the processes and systems are in place from procurement down to waste disposal, and what patient care program or activities is there in place. And this included to take a look very well on how prepared are they in managing adverse event that would happen after immunization. Next slide. And these are the things that happened. And to sustain all of this that we're working, it is important that there would be a legal framework that would support the things that we were doing. And we are very fortunate that we have our Philippine pharmacy law, which was passed in 2016, that included already immunization as one of the functions of a pharmacist that is certified by the Professional Regulation Commission. Now, another law, as I've mentioned, was passed early this year that authorized pharmacists and other health professionals to be COVID-19 vaccinators. So this is to fast track the readiness of the pharmacists to be there, joining the team that were administering the COVID-19 vaccines. So these two laws are very important to sustain whatever we have started to do as pharmacists working on vaccinating. Of course, the vaccines that were allowed to be administered by the pharmacists right now are adult vaccines, like the COVID-19 vaccines were part of that, then flu vaccines, pneumonia vaccines. Next slide. Now, further, we need to sustain how the pharmacists are doing, how we are trying to contribute our share to improve access to vaccination by training our pharmacists how they could address the C's in vaccine hesitancy. There is the 3C that we defined like confidence. We need to build the trust on how effective and safe vaccines are, because you and I know that there are still people who lacks the confidence in the vaccines, that the vaccines couldn't do much to them. So this is one area where the pharmacist can do a lot. And another area that the pharmacists could work on, that we have to train our pharmacists to address, is the issue of complacency. Vaccines anyway would then really be necessary for me to be not able to be infected with any, or to have the development of any vaccine preventable diseases. So it's very important for pharmacists to address this, because we are there in the front line with the people in the community. And the third C that is identified here is convenience. I don't like to go to have my vaccine shot because it's very inconvenient to me, and all other reasons that are being taken. So pharmacists can very well be addressing this, especially because we are all over the places throughout the country. In terms of accessibility, in terms of convenience, pharmacy is a facility that would be very convenient for everybody. Next slide. And all this, we say as we move forward, it's how all of this had happened, the strengths that we have that we could proudly declare, as pharmacists. We all were able to do this because of the passion and the commitment of the pharmacists to really help in expanding the immunization program or the immunization activities of the government and even in the private sector. So we have a very strong, another strength that we saw that make us succeed in this initiative is the very good relationship that we have with a number of patient organizations. So these groups also were very much in support of the pharmacists were doing this for them. And some of the challenges that we encounter, of course, is I would always say the still lack of recognition on the value of the pharmacist to do this. While this is very much improving, there's a very significant improvement that is happening on how we are recognized as healthcare professionals. Still, I would say we're struggling in some areas in this aspect yet. But then the pharmacist, you and I know, does not have that word or that thought of something that cannot be done. We said we can always do what we would need to do. So moving forward, the Philippine Pharmacists Association is there to be available to really improve how vaccination is happening. We continue to certify our pharmacists. We support our pharmacy owners, set up the services for them, gather data to support expansion of the Pharmacist Vaccination Authority in the future. So we have something to be used as a tool when we start to lobby to expand the type of vaccines that we could use. Next slide, please. Next slide. And we did this guided with the fact that the pharmacist is there. The pharmacist is trained to do more and be more to anyone who use medicines. And the pharmacist, you and I know, could significantly contribute to improve health outcomes of patients and advance preventive measures to maintain good health. And one policy change, I would say, that is necessary to sustain what we are doing as a pharmacist is really to have this be provided in a pharmacy professional law, or to lobby for a policy that would be released by the Department of Health to support pharmacists doing this, because pharmacists, after all, you and I know, is found all over. We are in accessibility of people to us is there, very good. Next slide, please. As we said, how a pharmacist is often the first place for people to seek help within the healthcare system due to our accessibility. So if all pharmacists would be able to offer these services in the respective pharmacies, access to vaccination definitely would really improve. And I know as experience, people feels more comfortable to approach a pharmacy for their vaccines. So thank you.
Great. Thank you very much, Leonila. That was an excellent presentation. So our final speaker is Amrahi Wang, who's the president of the Malaysian Pharmacists Society. He's a graduate of the Science University of Malaysia and has served as a hospital pharmacist for 35 years at the University Malaya Medical Center in various roles, including Chief Pharmacist, Deputy Director. He's currently a member of the Pharmacy Board of Malaysia, the Poisons Board, Medicines Advertisement Board, and the National Patient Safety Council, and in a range of other roles within pharmacy practice. Please join me in welcoming Amrahi Wang to speak to us about vaccination. Thank you.
Thank you, Parisa, for your kind introduction. To fellow esteemed panelists and everyone present here, good morning, good afternoon, good evening, and good night, wherever you are. My name is Amrahi Wang, the president of the Malaysian Pharmacists Society, MPS. Many thanks to FIP for the invitation to speak today on behalf of Malaysia, a country within the Western Pacific region. Next slide. The Western Pacific is a diverse region, home to almost 1.9 billion people in 37 countries. The nation with different development and income levels, including developed countries like Japan, Singapore, Australia, and developing countries like Malaysia, Vietnam, and the Philippines. It has a varying size and population, each having challenges of their own. For example, comparing Singapore to China. Next slide, please. For vaccination in this region, there is a different focus for each country. Many countries have their own national immunization program, especially for children. It's found that all countries are sustained polio-free status, as well as success in measles, rubella, and hepatitis B containment. For COVID-19 regionally, there is approximately 8.6 million confirmed cases with excess of 118,000 deaths, while in Malaysia, we have 2.28 million cases with almost 26.8 thousand deaths. Throughout the pandemic, the Western Pacific countries have varying COVID-19 strategies and vaccination levels. Next slide, please. Malaysia is a middle-income country with a population of 32 million, encompassing two main regions, the Peninsular Malaysia, 11 states, and Borneo, 2 states. Currently, we have a population of urban 75% and rural 25%. Now, there is rapid urbanization, and Malaysia is moving towards an aging society with 7% of the population above 65 years. Next slide, please. Since the 1950s, Malaysia has the National Immunization Program, NIP. It is free to all children of residents. From 2015 onwards, non-Malaysians are required to pay a small sum to access NIP. The children vaccination delivery involved 141 public hospitals, 231 private hospitals, 3,332 primary healthcare clinics, both in private and public, and a mobile team for school health service. Next slide, please. As for the adult vaccination, it encompasses healthcare workers for Hep B and influenza, food handlers for typhoid, pilgrims for meningococcal influenza, travelers for yellow fever in affected zone, and special areas for example, cholera in vulnerable areas in Sabah. Next slide, please. The vaccination coverage for children is more than 95% coverage. As for adults, the coverage is low. It's not being financed. For example, only 2% of Malaysians are vaccinated with influenza. For Umrah and Hajj pilgrims, although it is recommended, the uptake is only 26.6% for influenza and 25.4% for pneumococcal against WHO recommendation of 75%. Next slide, please. As in other countries, the COVID-19 vaccination effort is a national one. Malaysia achieved a resounding success led by the government with volunteers and private sector assist. NCIP is coordinated by both Ministry of Science, Technology and Innovation and the Ministry of Health Malaysia. The infrastructure was set up over a short span of time. Next slide, please. This NCIP was initiated on 24th February 2021. About 60% fully vaccinated adults was achieved on 26 September 2021 with 39.3 million doses injected over 214 days between 30th July, where 20% of adults are fully vaccinated, and 26 September 2021, where 60% adults were fully vaccinated in a period of 58 days. 13 million people were vaccinated. At the peak of the program, 500,000 people were vaccinated per day. Next slide, please. To date, 44.3 million doses were administered, of which 49.4% is Pfizer, 42.3% Sinovac, 8.1% AstraZeneca, and 0.3% CanSino. A total of 87.6% of adults 18 plus were fully vaccinated, with 94.3% with one dose of the vaccine. Currently, the focus is on adolescents with 35% fully vaccinated and 55.7% with one dose of the vaccine. Next slide, please. Currently, an improved information platform has been provided. Currently, an improved information have been provided by the COVID Now dashboard, and the COVID-19 vaccination effort shows the region's strength in its ability to mobilize resources to get the buy-in from the public and uphold the collective public health responsibility. It was led by Honorable Kaidi Jamaluddin, the current Minister of Health. However, mobilized resources are short-term and non-sustainable. Therefore, we need to focus on the long-term solution. Moving ahead, next slide, please. Moving ahead, we want to utilize the experience and success of COVID-19 vaccination effort. We need to turn from short-term to long-term by having more public care coverage. In doing this, we need to improve advocacy, education, and access. The targets are the risk population, example, urban poor, rural communities, foreign workers, and refugees. We also need to build on the adult vaccination financing to improve uptake and access. Next slide, please. As mentioned earlier, the current program focuses on childhood vaccination. So, moving ahead, adult vaccination is recommended, but there is an issue with respect to the funding gap, needing out-of-pocket expenses. We need to address the lack of awareness of the impact of the lifelong vaccination on health and productivity, and the lack of a centralized and computerized immunization record must be addressed for better surveillance. Next slide, please. We notice that a lack of inclusion of community pharmacies leave a large gap in coverage. The 3,000 community pharmacies can additionally be utilized, potentially doubling primary care healthcare vaccination point. The legislative barriers about vaccine requiring prescription need to be addressed too. Also to address the religious concern, for example, WHO halal status of COVID-19 has shown to improve uptake. Next slide, please. From the perspective of R&D and production, there are challenges to this effort in terms of insufficient qualified workforce for the development, budgetary and economics of scale constraint, leading to reliance on overseas supply, lack of essential facilities, and the know-how and the need to improve vaccine production quality. Next slide, please. MPS has consistently voiced out that pharmacists must be involved in advocacy, education, and administration. The advocacy and education is already part of MPS and pharmacy efforts. The next step is administration to close the loop and improve access. We need to focus on the gap, the adult vaccination only, for example, influenza, pneumococcal, and COVID-19. This is a real need. There is a real need to consider health financing for adult vaccination and improve data collection. And finally, to address the legislative hurdle by moving vaccine from prescription only to pharmacy only items. Next slide, please. While waiting for this change of policy, MPS has initiated a certified training on immunization for pharmacists, CTIP, with University of Science Malaysia, USM, to train the pharmacists. We consistently provide continued and persistent advocacy and education, including addressing misinformation. We also consistently have continued engagement with FIP, with PAPA, and also other regional organizations. Next slide, please. Finally, I hope my sharing will benefit the audience across the globe, and I end my speech with a big thank you to everyone. Terima kasih.
Thank you very much. If I may please ask all of our speakers to come up so we can see them, and we will ask our participants, if you've got any questions, please put them on the Q&A part. So we've got about 5 minutes for some questions, and whilst we see some questions come up from our participants, may I please ask each panelist to comment on the key or critical strategies that have been utilized in your countries to enact policy changes to ensure that pharmacists are able to provide vaccines, and what advice would you have for countries who are perhaps being challenged in order to get pharmacists to provide vaccines to children and adults in all potential locations and be paid for providing the service. May I pose it to Stephanie first and then go round that way?
Sure. So in Singapore, pharmacists currently are not able to administer vaccinations. Although during the COVID-19 pandemic, there was actually some concessions made for pharmacists to actually help out in the vaccination centers. But this was done under very strict regulatory requirements, and they had to be supervised by physicians. So unfortunately, I have no advice because Singapore doesn't have pharmacy administrators at the moment. But I think what we're trying to do is actually look at how pharmacists can value add to the whole process. In terms of accessibility, trying to actually help in patient education and see how this can actually be some levers for us to actually promote pharmacists as vaccinators in the country.
Great, thank you, Stephanie. Chris, would you like to go next?
Of course, thanks, Parissa. If I can reflect on what helped Australia become successful, it was evidence. And so the very first trial that we had was a research pilot and asked participants or people receiving the vaccination, was it a good experience? And we used that to demonstrate. We also sent out surveys to people currently receiving immunisations in pharmacy, so the year prior, delivered by nurses, and asked would they be comfortable if a pharmacist delivered the vaccinations. Over 99% responded yes, and they also had commentary around, I thought it was the pharmacist already given it. The other thing we do, and this is the great work that FIP is doing, is leverage what other countries have done and been successful. We are lucky to have a neighbour in New Zealand who was well ahead of us, and we don't like being beaten by New Zealand in anything, Parissa, so that was really useful. But we did come across some barriers, and just know that's going to happen. There will be certain parts of the establishment that won't feel comfortable with pharmacists doing it. What we also have been lucky with COVID-19 is to demonstrate the number of immunisers that have been stood up who were not medically trained, and demonstrate how with the right process and protocols that administering a medicine is not as difficult as it has been made out. So any advice is look at the evidence that's currently there, do set up a trial and demonstrate that, and give confidence to those who might feel that pharmacists don't have the skills. It is clearly within our competency to do so, and really happy to take to present. And I was blessed to speak to some around 2,000 pharmacists in the Philippines to give that similar advice just 2 months ago. So leverage off your international colleagues would be one other bit of advice, Parissa.
Great, thank you very much, Chris. Leonila, maybe you can give us some of that evidence as well.
Yeah, thank you very much, Parissa. Of course, I would agree with Chris. We need to have on hand some evidences, maybe taken from, not from within the country, but from outside. And then the next thing, so that you have something to hold as a tool when you start to negotiate and lobby with and discuss with people, with especially legislators and policymakers. And then the second thing that we did was to bring in external pharmacy leaders, because sometimes they would believe more in people from outside that would be talking about it than us ourselves talking in lobbying for it. So we have to bring in leaders, and I thank Jan to be one of those that came to help us also. We had the FIP leadership who came to the Philippines to help me, and in fact accompanied us to some of our regulators. We visited, we set meetings with them, and then the third thing that we need to do is really to be clear what we want to lobby for, and be equipped with the tool that we will have to present to them. Organize a small group that would serve as your champion, so that you will be thinking in the same line as you start talking to especially policymakers and legislators to lobby for a law and for any legislative framework in that matter is not easy. It's really a climb, in a hard climb to do. But then when you are equipped with the tools that you bring to show to them that what you are asking for from them is for the benefit of everybody, including them, including their family, it would be easier for us to convince them. So that is the thing. So, and we need leaders who are passionate and committed to start the work of lobbying for a legal framework and would not give up in the middle when there are already difficulties encountered, because there should be someone who would really push until the end when you get what you want to do. And then I always tell my fellow pharmacists here in the Philippines, when we started to lobby for the passage of the law that included immunization or vaccination as our function, that giving up should never be taken as an option to a pharmacist, because there's nothing impossible if you are clear with what you want to happen. All you have to do is to work for it and it will happen. And we had patient groups who were with us as we did the lobbying for the law and the policies, and of course talk and be clear with our position on how the pharmacists can really help make this more accessible to the community.
Great, thank you. Very wise words. And Rahi, what is your perspective on this?
Yeah, I think in my situation, I think the situation in Malaysia is the same as in Singapore. Of course, when we see the things happening in the Philippines and in Australia, of course, we want to get there, right? So our focus is now to make sure that we are prepared. Yeah. Okay. Well, you talk about the political will. Yeah. The current health minister is actually supporting us. You know, he said that it's not a rocket science, you know, to administer IM what you call the vaccine. So it's not rocket science. You know? So I think the onus is on the pharmacists from now on, you know, to actually convince them. Yeah. So that's why MPS work with USM to make sure that we have a certified program and to make sure that our competency is not being questioned, and so that, you know, people will trust us, you know. And at the same time, as in my presentation, we are talking about for the long term. As you know, this COVID-19 will become an endemic, you know. So I don't think why every country can do the mass vaccination that we have done the previous time. So I think it's a matter of time that we have to realize that it will happen, and I don't think any government can actually address this. As you know, until now, you know, of course, the NRP is still free. Even the COVID-19 vaccination is still free. But if you move forward, I think the thing will change. You know, so I think the work that MPS is doing is basically to prepare ourselves, to be prepared that once the government give the go-ahead, then I think we should be able to do it. So I have strong belief with the Malaysian pharmacists, because they have proved during the vaccination in other areas of the vaccination program, we are really up there. In other than this, we are all up there, especially with the logistics, you know, and doing a lot of things in terms at the vaccination centers and so on and so forth. I think it's just one step before. So pray for us. We hope that FIP will support us, colleagues from all over the world will support us, and we need you to help us. Thank you very much.
Great. Thank you, Rahi. And I guess that's a call out to everyone, is that FIP is here to support in all aspects in relation to pharmacists' role. And again, other countries within the region are there to support. So our next, I guess, look into the vaccination is the vaccine hesitancy. And as pharmacists, we obviously have a role not only in vaccinating, but also giving advice. And as Stephanie noted, seeing what other pharmacists can do. So if I can again pose a question to the panel as a whole, and maybe we'll start with Chris and go around that way, is what have your countries, what's the approach been around vaccine hesitancy? And how have pharmacists been involved in addressing the issue, I guess?
It's really great timing to ask that question, Prissa, as we're getting to that last stretch of COVID-19. So we do have quite a lot of vaccine hesitant patients who are attending the pharmacy and asking questions. What we know is that around 10% of them, they do have legitimate questions. They need to be listened to and they need to be legitimised when they come in. We have, in terms of supporting the profession, I'm lucky to work for an organisation that provides education, and we specify that education around vaccine hesitancy. And the majority of times it is about answering questions and legitimising fears that people have. I'm really proud of some of the numbers that we're getting. It shows that people who might be hesitant because of needle phobia or who've had an adverse effect to other vaccines, they're still coming ahead. And what we find once we get past the access point, so our issues early on, not just with COVID-19, but other immunisations, is to make sure we're providing clear access and easy access, which why we support immunisation by pharmacists in every location. We take away the cost, particularly if it's funded, but then the last part, and we know anywhere between 10 to 15% where we can make a difference, and it's all around having the answers and not judging when someone might be hesitant, because it's really legitimate concerns and they may have personal experience, and it's listening to that and being able to administer the vaccine if they are ready and when they're ready, and not forcing it.
Great, thank you. Leonela, what's the situation in Philippines, I guess, around vaccine hesitancy, and what have pharmacists been doing around the area?
Thank you, Parisa. In my presentation, there was one slide where we summarized into 3 letter C's how we addressed vaccine hesitancy. Number 1 actually is the confidence of people, because there is that belief that vaccines is not as effective as it is claimed to be, and it's not as safe as it is declared to be safe. So we need, as pharmacists, to understand how all of these are being manufactured, how all of these are being developed. We need to educate, because especially we are in the heart of the community, we are in the front line. It is us who is most accessible to people, who would be giving education in better awareness, or better information to them of what exactly are these vaccines. The second C that I identified there actually is the complacency, because there is that thing existing where there is a the perceived risk of vaccine preventable diseases is low. There is that belief in people that it's not necessary for me to have a vaccine. Anyway, this will not happen. So we need really to let them understand how these things will happen. And the third letter C that I've identified there is convenience. People wouldn't want to have the vaccine because it's inconvenient to go to the facility to be vaccinated. Now we said pharmacies are spread all over, and it would be a very convenient facility for people to go to have themselves be vaccinated. And this was one area also that we utilized as we negotiated with our policymakers on how we could help, how pharmacists could help expand vaccination activities. So these are the 3 things that we're doing, and we are training. We need pharmacists to be very good negotiators, in other words, so that we could convince people when we start to say something. So that's
Great, thank you. Thank you very much. Amrahi, and your perspective on the vaccine hesitancy and what your country has been doing.
I was actually listening to Chris and Leonela. I think I agree to both of them in terms of from what perspective they are talking. But I see if I can cover from another perspective. Yeah, when you talk about vaccine hesitancy, actually there are 3 types. Okay, number 1 is really very confused and so on and so forth. And you need to educate them. There's one group. So vaccine hesitancy. The other group is that for whatever reason that you give, they do not want to take. Okay, for whatever reason you give, they want not to take. But the third one is really it is really a problem. The one who's actually going to the social media and and intimidate and instigate the others. So in Malaysia, we have actually identified these three. And we have to have different approaches, to all these three, because at the moment the latest data is like this. When you talk about the overall population, we have actually vaccinated 75% of the population. So we still have 25%. Okay, so we cannot have this vaccine hesitancy because yes, we know it's going to go into the endemic phase, but at the same time, we'll try to get as much, people to be vaccinated. And then now people talking about the booster dose and so on and so forth. So we still need to do all this. So I think this is where the role of the pharmacists, even though in Malaysia we are not doing the administration per se, but we did a lot of things on education and advocacy. And I have to praise my community pharmacists in Malaysia, because despite all the barriers that they have, they still find time to educate the public, because they are in the community, So these are things that I really salute my community pharmacists in the community to again. So yes, wherever it is, we have a role to play. All right, if we are given the chance, we will vaccinate. So that is the thing that is happening in Malaysia, and we are very positive that the thing will change in the future. It's just a matter of time. So as I mentioned earlier, we want everyone to support us, and we really need the support from everyone across the globe.
Great, thank you. Now, Stephanie, the figures in Singapore look great. So I don't know how much of a vaccine hesitancy there is in Singapore, but what have pharmacists' role been in addressing the situation, if there has been even the smallest bit of hesitancy?
Well, I think for COVID, there's maybe less hesitancy, but if you talk about other types of vaccines like influenza, the rate is quite dismal. So I think the Pharmaceutical Society of Singapore actually during Pharmacy Week last month actually had this very good theme, which I thought applies to the role of the pharmacist, and it is partnering you in your health journey. So I think the pharmacist's role then comes as a sort of a health buddy, because no matter your setting, whether you're in the community, whether you're in the hospital or in the polyclinic, when your touch points with patients and then you see them, you understand their fears, and sometimes it's really fear, misunderstanding, miscommunication, and it's more of being a partner and actually helping them to sort through this information and helping them to see the importance of the vaccine. This might not be a quick thing. It might take time building trust. Especially when you meet the patients over many visits, and I think that's when the fruit of their efforts will then be seen later on.
Great, thank you. John, I believe you've got a question for the panel.
Thanks, Parisa. Yes, there was a question that I wanted to pose. So we recognise the three roles that pharmacists can play: assuring supply, addressing hesitancy, and potentially administering. And we understand that the pandemic has created a lot of interest and some opportunity for pharmacy to promote its roles here. But just as Amrahi said during his talk, we expect the COVID virus to become endemic rather than pandemic, and the vaccination become a routine vaccination process. Now, there are various methods for distribution for childhood vaccines, and often pharmacy is not involved in that. It's through other processes. We have this great opportunity to be involved as a profession in adult vaccination programs, which are currently quite low in most of our countries. A number of people over a number of years reported the relatively low vaccination rates for influenza in adults. So my question is, and it's particularly to Stephanie and Amrahi, who have a lot of involvement with government organisations, departments of health and like. How do we promote pharmacists to be involved in vaccination of those sorts of adult vaccines, particularly when there are other professions who think this is their territory? How do we convince the doctors and the nurses and the like to make some space for us? Stephanie?
Yes, so actually that's the exact situation I'm in now. We are looking into this, and it's a very delicate balance, striking maybe what they would term as their rights to perform vaccination. So it's really a task of like what the rest of them has said about getting information from other countries, putting forth hard facts, trying to also perhaps not see this as a like wrestling away the rights from other healthcare professionals, but actually a complementary role. Like, okay, you can do this in your setting. I have my own setting. People might prefer mine. People might go to yours. I mean, and sort of find this harmonious balance, which quite a challenge. But I think we need to work towards that for the greater good of the society, and perhaps see past the different needs of the respective healthcare professionals.
Rahi, what do you suggest we do?
I think most important thing is the fact with what I'm trying to do in Malaysia is actually to really work together with other healthcare professionals. Okay, because in one of my approaches is the fact that actually I belong to a coalition in Malaysia. We call it the Malaysian Health Coalition. And in that coalition, we have a lot of doctors group and nurses and other health. So that's the way we actually involve with them, and to make sure that what are the roles that we can do. And as you are aware, John, the fact that if we want to put this into the primary healthcare, all right, so this understanding is very important. Yeah, I think especially the doctors, they have to realign even their roles, okay, because I think they are needed in terms of a lot of things that need to be done in the GP setting, you know, and we can actually do more. So I think these are things that is going to happen. I give you a good example. You know, after the pandemic, we can see that the digitalization, of things is happening. So we talk about telemedicine. We talk about telepharmacy and so on and so forth. And true enough, you can see, all this, what you call online application and so on. You can see now the doctors are willing to work with the pharmacists. So these are things which I see, approaches that we can do, and to tell them that we're not taking over your plate. What we are saying is that you can be part of something good for the population and something good for the nation. So I think this is something it's up to us, what you call, for the community pharmacists, the pharmacists to come up, okay, be professional, okay, even though we have all the barriers. Because my thinking is like this, John. You see, when you talk about community pharmacists, community pharmacists means the pharmacist is within the community. It is part of the community, right? And we are actually a health hub. So we are talking about health literacy. So there's a lot of things that can be done to educate the public and so on and so forth. So when there is trust for this professional, I'm sure, whatever policy that the government will come later on, they will accept that the pharmacists will be part of the healthcare system, and we'll be able to do that work. And so these are things that we hopefully say. As I say, we need across the globe, for us to hold hands and see what we can do for each country in the world.
Chris, we know this was a challenge in Australia when we started. What was the answer?
We showed that there was a gap, right? So particularly for the adult vax, and you pick up a really good point, John. We are blessed. Our childhood vaccination rates historically have been outstanding. So there wasn't necessarily a gap there that we need to fill, but there definitely was for adults. Influenza is a wonderful example, particularly for over 65s. What we demonstrated that giving access to pharmacists, it gives you a 10 to 20% lift in that vaccination coverage. So it's clearly also showing that you're not taking away from anyone else, you're adding. And what we saw with influenza vaccination coverage, we actually saw GPs do more. And so as soon as they turn on pharmacies, we've seen a continual growth in our vaccine coverage for the vaccinations that they've allowed pharmacists to do. That's probably the main thing. It's identifying the gap, making people realise we're not there to take anyone else's role. We're there to improve access and demonstrate the lift. So that's probably the way that we did get across the board. We're quite lucky.
Thank you. Teresa, I'm not sure whether we've got other questions in the chat, but there's one other. Go on.
I was just going to say there's one other question I can ask. We've got some time, John, unless you've got any other questions.
No, go ahead.
I was going to touch on the subject of payment for pharmacists. Chris, we all know in Australia we're probably getting half of what doctors are getting paid for. And I'd love the panel's view on why are we considered to be half the value of a doctor? And how can we go about convincing governments that the price should be the same? And I guess why? Why are we regarded as less value? Can I start with you, Chris? Because this is, and we know that it's quite close to our hearts in Australia.
I get a little bit emotional about it because it is outrageous that it occurs. It is the exact same service, and having very similar conversations and investment into delivering it. So it's outrageous. We've reflected a lot on it, and we suspect that it's multifaceted. There's some historical hierarchy in a doctor is here and then everyone else is below them. And so the doctor has done the training and then everyone else may not necessarily have that same value that they add. And we also have seen within policy decision makers, they are highly stacked by a lot of medical practitioners who may not necessarily understand the training that pharmacists have done or the value that they can bring. So from a longer term perspective, we need more pharmacists in those decision-making roles. Whilst our advocacy is great, and we will continue to do that, until you have someone who are within the bureaucracy and helping to inform those decisions, I think it's going to be a long-term game for us, but we've identified that as a massive gap. I, for example, sit on some advisory panels for the government, the only non-doctor on them, which is outrageous when you look at all the contribution that other health providers. So I have to speak up not only on behalf of pharmacists, but on other allied health. So look, it's expanding the workforce, but also realising that pharmacists' role is clearly there on the front line, but also we need to expand out into other government roles to make the decision. We will continue to demonstrate the value. The other thing is that the doctors will decide not to do something unless they get paid. Pharmacists do subsidise and cross-subsidise what they do. With the sale of a product, for example, there's some history there. We do deeply care for our patients. So even if we're not paid, of course, we're going to give the advice, Parissa. We will let people come and see us for free. That's in our nature and that's never going to stop. So it will be a long time, but we'll never stop doing that until we get more pharmacists within the bureaucracies who help to make the decision.
Sounds like the bureaucracy needs a bit of diversity and inclusion as well. Leonila, what's the situation in the Philippines in terms of payment?
Okay. Parissa, I was a little bit laughing when payment was talked about, because when we thought of this included in the function of the pharmacist, while payment is at the back of our mind, we did not talk about it in any way because we were still convincing them to believe that we can do it. But definitely, yes, we are gathering some data that would somehow be used as a tool by us when we negotiate with our government for payment of this. Now, there was an initial discussion that I have had because I sat with the advisory council of our Department of Health on this, and the government is willing, for as long as we are equipped with and be able to convince them that there is indeed really a value that we can deliver doing it. And they have seen that now while we are because we are with them and we are reinforcing the workforce requirement for the COVID-19 vaccination team. And in fact, the pharmacist in the team is already paid as of now, except that it's still not really that high, if I would say, but it's a good already payment that's being done. In the private sector, the payment is not there. It's the payment for the vaccine where you earn a certain margin. So the services is not included. So what we would want is really to clearly define how much should be for the services. And I know the government is willing to do that, because in my initial discussion with policymakers, they're willing. It's a matter of us putting in place how we could be able to let them understand why we should be paid. So I'm very positive that one day this can happen.
Sounds like we need some, again, working together to figure out how best we can support Philippines as well in terms of the payment. Okay, time is getting to the end. And before I pass on to John, I'd like to take this opportunity to thank the panelists for great presentations and a great engaging discussion. Over to you, John.
Thank you, Parisa. Thank you for assisting in this process. Let me try to provide a summary of what we've heard and what I think are some key messages. I've had the very fortunate position as president of the Western Pacific Pharmaceutical Forum to visit most countries in our region and gain an understanding of our health systems. And it would appear to me that what we have to do is be very selective as to how we start this process. We all have great aspirations. We would love to be doing all these things for all of our patients. But there are some lessons that Chris has demonstrated. In Australia, vaccination by pharmacists was introduced as a result of a well-structured study. So there's your need for evidence. It was done in one jurisdiction, one state. And so that shows, don't try and bite off the whole country at the start. Just choose somewhere where there's good potential. And it was done with one vaccine. And of course, there were age limits around that, adult only. And so having achieved that on the basis of evidence and being able to prove that we could do it, there was the possibility of other states saying, oh, maybe we could have our pharmacists do that as well. And eventually there was the possibility of saying, oh, maybe we could have pharmacists administer other vaccines. And eventually we could have pharmacists administer for more than just adult populations. And so we need a long-term strategy here, tailored to each of our countries, based upon our political structures. So that's, I think, a very, very critical take-home lesson. I said a few minutes ago that COVID is creating a sort of a stronger interest in the potential for pharmacists. And we can use that, but we will eventually get to COVID being an endemic, potentially annual or frequent vaccination. And we have this opportunity to build a role in the administration of vaccines for adult populations in particular. But we really serve our communities greatest at the moment by promoting all and any vaccination. Rather than just sort of be selfish about what we as pharmacists might gain out of this, we've got a public responsibility in promoting vaccination. And I think that's what our member organisations need to focus on. That's what I think we should have our pharmacists do. And whatever resources we can give them, perhaps it's the 3 C's that Leonie has mentioned, we need to help our members promote vaccination through the life course, regardless of the disease. So I'd like to also thank our speakers tonight, Amrahi, Leonie, Stephanie, and Chris. I'd also like to thank our colleagues back at FIP who've made this event possible. They do a huge amount of work organising these things, and yes, yeah, they do deserve a great round of applause. FIP has delivered a phenomenal range of education through webinars over the last 12, 18 months. There is so much to tap into. And while this event was for the Western Pacific region, I've noted that we've had attendees from well over 11 countries, and most of them that have registered in the chat have been from outside of the region. So welcome everybody. We really appreciate your interest, and I do recommend you sort of pay attention to what FIP is offering, not only in this topic but others as well. I think there was a closing slide or two that we were meant to show you around these coming events, but let's have a look at that. So we've looked at this as a regional event, but on the 4th of November, you will see there, there's a further event on this. The time slot there, 1100, is Central European Standard Time, so you'll have to work out your local time for that. This is available to you on the FIP website. And then on the next slide, if you want to be able to access these events, scan that with your phone, and that will give you a contact to those events. And finally, we'd like to thank you all. Thank you for showing your interest. Thank you for the chat comments that you've provided. And thank you, Parisa, for assisting in this. And thank you again to our 4 speakers. Great presentations. Thank you, everybody. Goodbye.
Thank you, John. Goodbye, everyone.
Thank you.